Hey everyone, I'm Kayla. I am a second year anesthesia resident. I'm also a mom to toddler twins, and I am fortunate enough to join Influence podcast today and talk with a company, Resolve, and Kyle. And I'm super excited. So we can go ahead and get started. To kind of briefly talk about Influent. Influent is a network that inspires the next white coat generation through media with 12,000 plus members. They offer peer-to-peer resources on everything from contracts and CVs to well-being and burnout prevention, salary negotiation, and financial planning. They're inspiring lasting change in the careers and well-being of the next generation. And I'm here, like I said, with Resolve. They are a legal team that provides resources for physician contracts, negotiations, things like that. And I will let them talk about kind of their mission as well. If you want to go ahead and talk a little bit about Resolve, Kyle.
Sure. Yeah. Appreciate it. Yeah. So Resolve exists to empower physicians as they move through their career, specifically in their employment contracts, making sure they have good access to not only legal help, right, and expert attorneys that know this industry and know this niche, but also good access to data, market information, salary benchmarks, all those things that are important and often times things that don't get taught in medical school or in residency programs. And so we help thousands of physicians every year on that specific topic. So happy to chat with you on it and answer any questions that you think are out there.
Awesome. I'm really glad that you mentioned that, like things that are not talked about in med school, because I think that is a key part to this. I know that in med school, I got absolutely no training on physician contracts. And now that I'm a second year resident, I'm starting to look at job opportunities and things like that. And I know that this is definitely an area where I lack knowledge in. So would you be able to like kind of outline the essential components of a physician contract that residents and maybe early career physicians should be familiar with?
Yeah, no, I'd be happy to. So most contracts are going to, range from anywhere from like 3 to 4 pages. If you're with an academic center, they can be really, really short and they look like almost like a letter in format, to potentially something that's 60 or 70 pages long. Health systems and private equity groups tend to have some very verbose contracts at times, and so the key pieces that you're looking for really are the same, right? Regardless of length. I mean, you want to make sure you've got what you're supposed to be doing defined correctly, whether that's, scope of practice, what shifts you're going to work, what your schedule is going to look like, right? What days you're going to work, how much call you're going to take, all of that day in and day out stuff is really important. And you'd expect to have that well defined, along with other things like, do I supervise APPs and do I, have any time carved out for administrative time or research, right? I mean, all those things are important. So that's kind of area, number one that we have to be paying attention to. Area number two is we want to be paid fairly. We need to know how we're paid and, what our production model looks like. And if we have stipends while we finish training or student loan reimbursement, right? There's a lot of things that go into compensation. And then the third area is really anything that hits on termination, right? Like you have to know how you can get out of the contract because most contracts aren't forever, right? We're gonna move through 2 or 3 different spots in our career, and so we have to know how we get out of it. If I want to leave, what does that trigger from a repayment standpoint on any of those incentives I might have taken, or do I have any non-competes that I should be careful on, or tail coverage, right? I mean, there's just a lot of things that are going to go into it aside from all the other language pieces and kind of legalese that are out there. I think you have to solve for the core right of the contract and make sure you're educating yourself on what you're reading.
Yeah. I know before I had the pleasure of working with Influent that I had no idea anything like a legal team for physicians and for physician contracts kind of existed. Can you kind of talk a little bit about like why it's important to have a professional review the contract? Because again, beforehand, I kind of thought, I just showed up, I talked to whoever was offering me the job. In my very unexpert opinion, I just read briefly and then I signed. So yeah, can you talk a little bit about that?
Yeah. Yeah. I mean, it's, I think that's the more common route, right? That you just mentioned. Like, I think most people do go through it and they want to trust their employers and they sign the contract. And, unfortunately, administration moves around just like you guys do. So the person that you're dealing with and that you're talking to on the contract may not be there 2 or 3 years from now when the problem comes in. And so what we find is that a lot of the verbal promises that recruitment makes, or a lot of the verbal promises maybe that an administrator makes, they may have good intentions of following through on that, but the next person coming in may not, even though that it's supposed to exist. And then they go back to your contract, and if the contract is bare on that topic or doesn't have it well defined, that's where problems come in. And so we think, and we joke a little bit about this. So I'm married to a physician, right? And so I hear my patients came in and they Googled it and they told me that, they understand all this stuff about medicine, and it drives doctors
Yes.
crazy. The same thing drives lawyers crazy when clients come into us and they're like, well, I looked at it, or I had Chat GPT look at it. And we're like, that's fine. You understand broad concepts, but do you know what this means specifically for your situation? And so I think you really need to be careful on what you're signing. These are big value contracts, right? Especially if you're coming out of training. Like, it's the first time you're going to make real money. It's going to be a really valuable contract for you. And so you have to make sure you get it right and know what you're signing up for.
Yeah, absolutely. Yeah, that's funny. Does your wife think that she went to law school by proxy too?
I don't think so. I try to stay out of the medicine, range too. It's like, I'll stay in my lane, right? Everybody stays in their lane. We're good.
I know you briefly talked about like determining fair market value. Depending, I'm sure that's obviously varies by a few different aspects and things like location, specialty, like that. Do you guys have is there a way for physicians to determine fair market value, especially considering the variations of specialties and locations, like I kind of said?
Yeah, I mean, by specialty specifically, right? I mean, primary care is much different than a surgical specialty, and so you have to have data that fits your specialty, first of all, right? And that's something that you're going to see in some surveys that are out there. There's MGMA, AMGA, Sullivan and Cotter. You're going to hear some references to employer benchmarks. That's what they're going to utilize for fair market value. And so if they're going to utilize those things, you should also have access to that. You also should be, hopefully, in the job market seeing 2 or 3 offers, right? So you're going to know for your personal situation what that looks like and what your value is in a specific geography. But then the other benefit is, if you don't have access to some of that stuff, sites like ours, you go to Resolve, you can actually see peer-to-peer information. So there's a stream of salary data and contract data that's coming through, and so we think as much data as you can get your hands on is best, right? And that's how you can start to get benchmarks on not only comp, but on things like, what's a normal non-compete look like, what's normal tail coverage look like. All that stuff is important.
Mhm. I know that amongst my co-residents, I kind of talked to them a little bit before coming on here, and I just kind of asked, what questions do you guys have about this? Just so I can kind of get like a little sample of questions, because I know that, again, this is something that we don't really talk about in med school. I'm not alone in the fact that we know nothing about the legal stuff,
Right.
and so I felt like one thing that kept kind of coming up over and over again amongst my co-residents was just like the different types of negotiating base salary, and I know one specific question was they were curious about like the pros and cons of being like a W-2 employee versus a 1099 contractor. And honestly, I am saying those things and I don't even really know the difference between them. So is that something that you can talk a little bit about?
Sure. Yeah. So when we talk 1099 versus W-2, then I mean, those are tax terms, right? So if you're an employee, you're going to get a W-2, right, at the end of the year to report to the IRS. If you're an independent contractor, you get a 1099.
Mhm.
And so really, that's what they're talking about: is, am I an employee or am I a contractor? If you're a contractor, you're supposed to have some more flexibility, right? You're supposed to control your own schedule, and your employer's not supposed to dictate to you what that looks like, and they're not supposed to control how you're delivering care, all those things. um, that also usually means that you're going to be paying for your own benefits, right? Your own malpractice insurance and your health insurance and all those things that go along with it. So I think there's a lot of discussion, especially in the physician space and kind of the online communities, about how 1099 work might be better for you, right? Because you can be more aggressive on your taxes, and there might be some retirement planning that you can do as a 1099 that you can't as an employee. And I think those things are true, but I also think there's some detriments, right? I mean, there's a lot of residents for sure are wanting to buy a house, and so if you're going to go look for a mortgage, there's different requirements as far as how you get approved for those loans. If you're a 1099, usually you've got to prove a couple years income, so that might delay you buying a house, as opposed to a W-2, but they can underwrite differently. So I think there's pros and cons to each of those. At the end of the day, regardless of tax structure and what setup you have, you want to maximize comp, right? You want to maximize your value in either of those settings. And so I think it does take a little bit of analysis, on what actually is hitting your bank account at the end of the day, to make sure you're choosing the right structure.
Yeah. I know you briefly talked about compensation. I know there are different models for how you're paid as a physician,
Mhm.
especially like I know in anesthesia specifically. We have jobs here that are salary based versus
Mhm.
compensation based. Can you kind of talk about like the benefits and pros cons of those? I guess.
Yeah, so you're likely going to see some type of base salary in almost every position. Now there are some that are pure productivity, right, where you're being paid on work RVUs or collections, or if you're anesthesia, ASA units, right? It depends on how they're going to calculate what you're doing every day. But almost all of them come with a base compensation or a floor that has a threshold of a certain amount of production that you have to cross, and at that point in time, you get a productivity bonus. That's going to make up probably 90% of your compensation. You may have other pieces that fall into quality metrics, or you might get stipends for being a medical director or supervising APPs, but that's usually 10, maybe 15% at most into all those buckets. So really what you want to know is, what am I supposed to take home in total compensation? And then how does that compare to what I'm being offered? Knowing that there's going to be some fluctuation, some variation in my productivity.
Mhm. I know that when talking about salary and compensation for job interviews and things like that, um, is it okay to bring up what someone else makes in the practice when negotiating? Like if we have, I know a couple of my friends were talking about this and co-residents were talking about this. They know of a friend who has a job and they're telling them what they're making. Is that like frowned upon or like how do you go about that?
Well, I think you want to go in saying I expect to be paid fairly, right?
Mhm.
And so fairness means that if you have a data point in the market that you know is higher, right, you'd have to have justifications for why it's different, right, for your situation. And so I would try to protect the information. I wouldn't say, hey, it's Dr. Smith's
Yeah.
contract and I know it's higher, but I think you can say, hey, I've got, not only do I have other offers in the area, but I've talked to my colleagues, they also have offers in the area that are higher. And I think you can utilize that as good leverage.
Mhm.
Your employers are going to want you to reference some type of benchmarking survey as well, and so hopefully you have access to all three of those things like we talked about before. But I would protect your friend's information in that setting. I wouldn't give that name out.
Okay. Okay. Um, do you, I know while we're on the topic of like negotiation strategies, are there other like, negotiation strategies that you guys kind of talk about that residents and like early career physicians can use to improve their salary?
Yeah, well, I think it's what you're bringing to the table, right? So I think you've got to know what your value is, outside of just, right, the market says I'm worth X number of dollars. It's why, right? Because somebody earns more than the median. Somebody's earning 75th percentile, somebody's earning 90th percentile. And so, there's different things about you individually that the practice will like, right? And so it's, are you from the area, right? How long do you want to be in the area? Do you have family, spouses, right? Longevity? Do you maybe speak a foreign language, or something that can attract more patients or different types of patients? Do you have uh, online presence where you're going to attract patients on your own, right? Like if you're in derm or in plastics or something that brings kind of that retailish value, right, to medicine. So I think it just depends on you specifically, but I also think you need to prioritize what's important to you, because we're talking a lot of comp right now, but sometimes compensation is not even the most important thing. Like sometimes people are valuing having Fridays off, or they're valuing an extra week of vacation. And so we always encourage you to push for what matters to you, not for what you think you should be doing based on, what your friends are saying.
Hmm. Absolutely. So I know I've talked a lot about like salary and compensation, but when we're going over contracts, are there any like common red flags that you guys see, or like what should we be looking for as red flags that kind of set off like alarm bells?
Well, the hottest topic on that is the non-compete stuff, right? So everybody, I think, is probably familiar with what the FTC was doing about a year ago, and they were trying to get rid of non-competes across all industries, not just medicine. But that's now stalled, right? It's been challenged, and one court struck it down, and so now it's being appealed. I do think that one causes a lot of problems for our clients. So if you um, think about physicians generally, especially those coming out of training, usually they're picking geography first. It's, I want to live in Cincinnati, or I want to live in Chicago. And so if that's the most important thing to you, and then you sign a contract that says if this relationship ends, you've got to leave that geography, that's a problem. So I think non-competes really reduce, one, career satisfaction, but also two, your ability to renegotiate. They compress compensation, and the FTC weighted on that. And in some markets, it's pretty heavy. It can cost you $100,000 a year in some situations. So I just think if you miss on, anything, right, don't miss on the non-compete, because that's really going to
Mhm.
tie your hands later on.
So if a contract has a non-compete, like, is there a way for us to negotiate that or like get that out of the contract somehow? Or how do you guys usually go about that?
Yeah, I think it depends on where it starts. So I think the geographic area is usually the most important piece. And so, if it's 10 miles and you need it to be 5 miles, that's a position to push on. I think there's also carve outs you can make on non-competes to soften them slightly. Of maybe it only applies to certain locations, or maybe there's good reason for it not to apply, like if they terminate you without cause. I mean, there's different ways to solve it depending on what you need, but I think you have to try to limit the impact, both time, scope, radius, right?
Mhm.
Exceptions. I mean, all those things need to be present.
Mhm. Okay. Um, I know that, especially being in anesthesia, although I know it's important in every specialty, but malpractice insurance is kind of another critical aspect. What type of coverage should physicians ensure that they have when it comes to malpractice?
Well, there's two main types, or maybe three main types that you'll see. It's either going to be a claims-made policy, an occurrence-based policy, or then some will just self-insure. And really, what your concern is I want to have coverage while I'm here practicing. So if I make a mistake and somebody sues me, right, I've got that insurance. But also, patients can sue for a statute of limitations, right? They don't have to sue you the next day. They get time to file the lawsuit. And so, what you want to make sure of is that you've got coverage until that statute of limitations runs out, and that may mean that you're not even working there anymore, right? So if you make a mistake on your very last day, for the most extreme example, and the patient sues you a year later while you're in job B, right, you have to know if you have insurance coverage. Well, in a claims made policy, you don't. So it only covers you for claims that come in while you're employed and you're no longer employed there. So that's why you need tail, and that's kind of the trigger, or one of the words that you're going to be looking for in the contract is, do I have that tail coverage that I need? um, it's often, defined well enough. You're going to have a good idea, I think, but don't just look for the words occurrence, because sometimes they'll have coverage limits and they'll throw an occurrence number in there. It doesn't mean you have occurrence coverage. So that's one of those don't rely on Google, right,
Mhm.
scenarios where you might be actually missing out on something that you think is there. So malpractice insurance can be expensive. So tail can be, in some specialties, a six-figure number. And so if you miss on that, right, I mean, there's potentially a six-figure insurance policy that you're going to have to buy, which you don't want to do.
Mhm. So does the tail usually cover, like the like you were talking about the statute of limitations for patients? Like, is that how long the tail
Correct.
usually lasts?
Yep. So that's what you want to make sure of, is that tail covers you for that entire time frame when a patient can sue, right?
Okay.
So whether that's, and that varies by state. Some states it's, 2 years, sometimes it's more. Kids can sue for longer because we don't force them, right?
Mhm.
We don't I guess penalize them is the way I should frame it, for a parent not suing if they should have. And so you just, based on specialty, based on state, you want to make sure that that entire time frame is covered.
Okay. I know earlier you kind of mentioned this, the termination clause. How important is that, and what are there specific details that physicians should look for?
Well, there's going to be two types of termination. So there's a what we call without cause, which means I just changed my mind, right? Like I just want to go a different direction, and or the employer wants to go a different direction, and so we give each other notice. A lot of times it's 60 to 120 days, somewhere in there, 2 to 4 months. Um, that's the most common way that a
Mhm.
contract will end. The less common way and the more problematic way is that if there's a breach, or if there's a for cause termination. And so what you need to be careful of on that is, in that laundry list of things that they're going to list out, is any of it too subjective for you, right? If it says, we can terminate you immediately if you violate a policy or procedure. I mean, we certainly don't know every single policy and procedure of an employer, right? They have handbooks that are huge, and so you don't want to have an immediate termination for something like that. You don't want to have time to fix that issue. So be really careful in two different types of termination. Obviously, if it's a termination without cause, you're going to want to have enough notice to be able to transition to something different.
Mhm. And those are things that can be negotiated, or is that something that most contracts don't really
Yeah,
negotiate?
yeah, no, I think, well, my position is everything's negotiable, right? So if it's in there and you don't like it, and it's preventing you from signing, you should be raising your hand and asking for
Yeah.
a change, or asking why it's there. But yeah, we do
Mhm.
see changes on the termination section frequently.
Okay, perfect. So I know now that we've talked a lot about different red flags and what, like, the components of contracts. What can people expect, or the contract review process to look like with Resolve?
Yeah, so ours is pretty straightforward. I mean, all of our pricing is flat feed, right? We believe in transparency, not only for compensation, but also for what we're doing for you. And so there's different levels of service. If you just need data and kind of a platform experience and instant access, there's that. If you want more of a what I'll call white glove, right? All inclusive, help me with all my contracts my last year of residency. There's that option as well, and connect with an attorney. Um, Most reviews, are going to take somewhere between 2 and 4 weeks, right? By the time you review it, negotiate it, right, kind of get it to the end. My biggest piece of advice for a resident would be start early. Engage with whether it's us or anybody else. Engage with them early, so you're not walking yourself into a corner where you have to make a decision in 24 hours and you don't know who to talk to, right? I mean, you should have your advisors and your people picked out, well before that. So um, we think if you're informed, you guys do a pretty good job, right, of analyzing information. And so I think there's plenty of it out there for you.
Mhm. And forgive me if you've already mentioned this, but are when it comes to your guys' packages that you were talking about, um, does that include like when you review a contract, is that per contract or is that kind of like once you buy it, you can review multiple contracts?
So some of them are because some people have kind of narrowed down, right, what they want to do, right? They know
Mhm,
it's I'm going to sign here, right? This is more of just like protect me type of review.
mhm,
There's also packages on there that allow you to have up to four, and we think that if you're doing a good job, right, and you're analyzing the market, you should have 3 or 4 offers that are legitimate in any area or in any practice type. So I just think that residents, I think for sure would be I would encourage them, get the advice on all the offers that you're looking at, right?
mhm,
Certainly if it's a renegotiation or something down the road, it's going to be a little more narrowed and a little more tailored for you. But early on, I think you'd be wise to evaluate the market and make the best choice so you don't have that statistic about burning out, right? And the statistic on moving 50%, right? Leave their first job. We think we can do better than that.
mhm. I know that we kind of talked about like the steps that were involved with the contract review with Resolve, but how specifically does Resolve help physicians navigate the process? I know it's like kind of overwhelming from our end. I know it's not overwhelming from yours because this is what you guys do
Yeah.
every day. But yeah, how do you guys help us with that? Like, what does that look like?
Yeah, so when you come in, you're gonna talk to somebody like me, right? You're gonna talk to an attorney that's done this thousands of times, right? It's kind of like when you go to the doctor, they're like, "Oh, this is no big deal," and you're like, "Well, this is the only time it's gonna happen in my life, right? So I want to make sure it's done right." Well, it's kind of like that for us. So we do this all day, every day. We can tell you what is normal, what's not normal, what you might expect if we're asking for certain things, and what an employer has done in the past. And so you really have somebody to bounce ideas off of. You'll have access to them to talk on the phone and email. Um, it's because of the platform feel. I mean, it's going to feel very much like other technologies you use. You can go on and book right calendar appointments and see data streams live. So um, we think that the experience should be one that you're getting your questions answered, you're educated, you're having help with that negotiation process, and you're not guessing, right? We don't want you to guess at what employers are going to do and what the market's going to say about your specific situation.
And this is kind of again, I probably should know this already, but when you guys are negotiating the contracts, do you guys interact specifically with the employers, or are you guys just kind of providing us the tools and the questions that we should be asking the potential employers?
Yeah, it depends. So there's levels of service where people just want to talk and they're like, I'm going to go do it on my own, and that's totally fine. We get that. Most of the clients though are going to want some help with negotiation, whether that's behind the scenes, right, and just talking to me through the process, like, help me. Does this email sound okay? Or is it, hey, go communicate directly with the health systems council on this for me and
Mhm.
handle the negotiation? All of that's available, all that's possible. I think there's certain benefits. There's times when it's better to insert your attorney, and I think there's also times when it's better for you to have a conversation. So I think again, it's situational, but it's all there and it's all available to you.
I love that because I know I would probably not be the best negotiator. And so I love that you guys offer that because that is something that I definitely would need. I would fold immediately. So I'm glad that that's a
Sure,
service you guys offer.
sure.
Um, I know that we've kind of talked a lot, but to wrap up the question portion of things, what is the most common mistake that you guys see doctors make when they're looking at their contracts?
Um, I think it's probably signing as is and not giving themselves enough time to actually go through the review process. So we have so many clients that will come in and they will have turned down every offer, right? They've decided that this is going to be their favorite one, and then we get the document and we're like, man, there's 10 or 15 things in here that are problematic for you specifically, and now they've already let go of every other legitimate offer. And so I just think not starting early enough, not being educated on this early enough, I think that's the biggest issue. I think once you do that, I think that, again, I said this earlier, but I mean it. I think physicians do a great job of analyzing information and analyzing data and making good decisions for themselves once they know. I just think it's the unknowing piece of this that is the problem. So start early, and if you do that, I think you'll be fine.
Awesome. As we're wrapping up things, at first, I just want to thank you so much for your time and for answering all our questions. This has been so incredibly helpful. So I appreciate all of the information that you've presented us with. If you had to summarize the things that we just talked about, like what would be the key takeaways from your end of that you want to reinforce before we wrap up this session?
Okay, so I'm gonna try to really simplify it, but it's gonna be one, you're gonna review your contract, right? You're not just gonna sign whatever they give you. You're gonna make sure you have access to the data and the information that you need. You're gonna connect with an expert, whether it's us or anybody else, right? Make sure you're talking to somebody who does this all day, every day. And then you're going to make sure that the contract is specific for your needs. So that there are red flags that we're going to spot in every single contract that sometimes are a problem and sometimes they aren't. But your document should be customized for you, right? And it has to solve for your situation. So that's my takeaway. Be educated, start early, get the information, and then make it personal. And I think you'll be fine. And then my last piece of advice is that anybody who's wanting to work with us and go through this process, make sure you use the discount provided by Influent. You can visit Influent, use code Influent10 for 10% off of Resolve services. They're really helping you guys out on this, and we hope you take advantage of that offer.
Awesome. Thank you so much. I want to reiterate how appreciative I am of your time. And thank you everyone for watching. And
All right, thanks.